We were able to get infectious disease consultation immediately while she was actually in the emergency room. We were able to really convince the orthopedic surgeon on call to act quickly, which is critical in a case like this.
I was there at night, early morning, crazy hours all day long. Knowing that I could call him 24 hours a day was, I've never heard of such a thing. It was nice in our small hospital here that we had the expertise of a world-class physician helping heal our daughter, and it was amazing.
Your success inspires us to innovate. Your telehealth initiatives have increased access to high-quality healthcare, creating outstanding patient outcomes. Today, we celebrate you.
Now that I have the access to Ontario Telemedicine, I'm able to see people wherever they are. If I wasn't able to use the OTN video platform, these people would not have access to this kind of therapy.
We live here on the northwest coast of Alaska, 33 miles above the Arctic Circle. So what? Man, we can deliver healthcare just like they do in downtown Boston, Massachusetts.
I definitely believe that the telemedicine helped to save my life.
So thank you for Tim. Good morning, ladies and gentlemen. I'm very happy to be here today and in Nashville. Welcome you to the first Healthcare Summit of Vidyo. I got my hat, I got my boots. I hope you all got yours. And we're going to have a great event. Okay, now we are more natural. Okay, so as I said earlier, I always wanted to lead a company that really helped to change the world. And it truly inspires me how our customers are doing just that. Vidyo wouldn't be here without you, our customers. There are some great care provider and some leader innovation solution here in the room. Yesterday, I spent most of my day with leaders from OTN, UPMC, Mercy, and others. And it was so exciting to hear how we as an industry evolved over the last couple of years. I see Gilad Epstein here from OTN. Good morning, Gilad. OTN at 2011 was the largest telehealth providers and Vidyo first customer in Canada. It's so great to see how they are still growing in a 30% pace year over year. Gilad will share with us later this morning about OTN. I also see Steve Sponsel from Mayo Clinic here. Morning, Steve. A couple of years ago, in a post-ATA user forum, Steve almost brought me to tears by sharing with us a video about how a clinician from one of the Mayo Clinic central location supported a doctor in one of the remote locations delivering a neonatal. This kind of thing is, what makes me proud at my work and helping to bring such a precious life. So that's awesome for me. Each and every one of you in the room is not only responsible for Vidyo's success, but also responsible for the success of telehealth as a means of making care more affordable, accessible, and effective. And I thank you for the bottom of my heart. I also want to thank our sponsors who helped to make this event possible and for honoring us to embed our technology into their innovative solution. I want to particularly thank Genesis, our platinum sponsor. Genesis is a leader in the contact center. Jim Watton from Genesis will share with us later how analytics can help in the patient experience and how integrating bots, AI, and self-service should be integrated into the experience. I also want to call out for our gold sponsor, ID Solution and AICU Care. They will share this afternoon some of their case studies and innovation solution and how they are improving patient engagement. All of our sponsors will be showcasing their innovative solution in the next door during meals and breaks. I encourage all of you to go to see some of very amazing things. Until this year, telehealth was in an early adopter phase. We just conducted a research that we will share in the next few weeks. And it's so exciting to see that nearly half of the healthcare providers in North America already using video to help their telehealth program. And from those who haven't started, 70% of them are going to adopt this kind of solution in the next couple of years. Kaiser Permanente is a great example of a leader who took virtual visit to the next level. In 2015, Kaiser's CEO set a goal for their organization that by 2018, 50% of their clinician interaction will be done in one sort of healthcare, of telehealth. They already achieved that goal by the fall of 2016, and today, 18% of their virtual visits are done over video. Kaiser Permanente also reported in July of this year that they have done more virtual visits till that, more than the entire year before. And the video visit into virtual visit is in the pace of growing or tripling itself year over year. Ladies and gentlemen, great news. The recent legislative around telehealth is going to remove significant barriers and going to pave telehealth into more rapid adoption. With telehealth becoming more of a mainstream, we as an industry need to move away from point solution into more scalable and deeply integrated solution that will make telehealth part of standard of care delivery. Our objective in this event is to encourage a discussion and to see how together we can drive this evolution. At Vidyo, we are extremely proud of our history of innovation and invention. The company was founded in 2005 with a vision to enrich human experience by visually connecting the world. There is truly no other industry that's get a greater meaning and life-saving like healthcare. In our earliest days, we enhanced significantly the technology of real-time video communication. We came with very strong set of APIs that till date help us to embed our solution in any workflow. In 2008, we were the first company that unleashed the video conferencing from the boardroom by releasing a software endpoints, leaving behind the hardware manufacturer like Cisco and Polycom. We started our partnership with Google in 2009 that led to the release of Google Hangout. We continue with this partnership till date, working collaboratively with Google about releasing of new products in their WebRTC, including the latest release of the VP9. In 2011, we signed our first partnership in the healthcare arena. We signed with Philips for the EICU solution, and we signed with American Well, enabling their direct-to-consumer solution. In 2012, we started our partnership with both Epic and Cerner. In 2014, we started to see rapid adoption around our customer, including Nebraska Medical Center, who used video during the Ebola outbreak. In 2016, we were awarded the Telehealth Technology Award by Frost & Sullivan and started our partnership with Allscript. And today, we are very, very proud to have 300 healthcare systems with more than 2,500 facilities that have deployed video telehealth use case across the care continuum. We are honored and humbled to have been selected by all of you as your trusted video interaction platform. There is no one company that can transform healthcare by itself. It's required ecosystem and a dedicated community. I'm very pleased to have most of this community here in this room. We have great care provider and some leading innovative solution with us today. It's very inspiring to see how we as an industry collectively impacting the healthcare change when you look at the care continuum. We have a lot of our customers that are enabling their patient to communicate with a physician from the comfort of the home using a PC or a mobile device. This, of course, reduces the ER escalation and therefore reduce cost. Henry Ford Healthcare System, together with our partner ID Solution, leverage the deep integration between video and Epic and allowing the clinician to stay within his Epic workflow and with few clicks connect with his patient without going away from his workflow, enabling the patient to connect with his PC, his tablet, or his mobile via the integration we have with Epic MyChart. Tomorrow morning, we'll have our award session about innovation award session. When we look at the nomination, there were some great stories about ambulatory care and how do you drive efficiency and increase efficiency and reduce the number of transfer. One of the speakers, one of our finalists in the morning will be Charleston Dorchester Mental Health Center. They will speak about the efficiency that they saw in there and the positive result they saw in their program. I don't want to steal their thunder, but I found this program specifically interesting because it's a collaborative initiative across different agencies, allowing the EMT connect the patient with a mental health clinician during the emergency call. You saw the young lady in the video we played whose life was saved by telehealth. According to our latest research, 43% of those of using video, using it for specialist interaction, bringing a specialist into the interaction. And those of you that already started to do it see very high level of satisfaction. Satellite hospital of the partner healthcare system are using experts from Mass General to assess their patient. Mass General itself is selling its renowned neurological program to other healthcare providers. This afternoon, we will hear from a very good friend Thomas from Children's Colorado Hospital, and a nice gentleman that I met only yesterday evening, Dr. Alfred Atanda from AI DuPont Hospital for Children, will share a tool that they build, an ROI tool that they build, how to assess the efficiency of using video in this kind of use case and other use cases. According to our study, inpatient care and monitoring is a prevalent use case among those that already adopted video and or planning to do it soon. We work very closely with Kaiser Permanente and our partner Getwell Network to enable virtual rounds by using the bedside patient engagement. Many of our customers, including some in the room, are using video integrated into the eCare Manager of Philips, enabling remote monitoring of ICU patient throughout the healthcare system and beyond. In fact, Emory has deployed a 24/7 program partnering with a group of physicians in Australia. There are many use cases in the post-acute. One of the earliest that was adopted is the remote monitoring and patient within focus on chronic condition patients with a focus on improving outcome and reducing of readmission. Later this morning, we'll hear in a panel Lorraine Feisen from Tallahassee Medical Healthcare, who will be sharing with us the positive result and the reduction in readmission that they have seen by using this program, and by them releasing the readmission with a home monitoring tool that can measure the vital signs and enable real-time communication between the patient and the doctor. Alaska Native Tribal Consortium also will speak with us about their hospice program and how it's enabled them in Alaska to reach some of their patients in a very remote and difficult to reach locations. Okay, we have a great agenda for the next couple of days. Our contact will focus on lesson learned, how to build measurement and ROIs, how to effectively scale a program, and where it's all going from here. This morning, we'll hear keynotes from Gilad Epstein of OTN, Dr. Ron Poropatic from UPMC. Later this morning, we will have Kate McCarthy, a senior analyst at Forrester Research. We lead a panel speaking about how telehealth is improving patient engagement. And then we will hear from Jay Sanders, the founder of ATA, his perspective about how telehealth was doing till now, and of course, what we are still to see from moving forward. This afternoon, we have some great speakers across multiple sessions. Topics that will be discussed is build versus buy, building an ROI model, and why a care system should have a virtual care center, and how you build one. Tonight we're going all to the Wild Oat Saloon. We're going to celebrate Halloween Nashville style. Hopefully all of you got your boots. Feel free to dress up for the occasion. But don't stay up too late, however, because tomorrow we have a very interactive day. We're starting bright and early at 8:30 sharp. And you see there is quite a discipline here in the organization. We're going to start with our Innovation Award session with some great nomination coming from some of you here in the room. And tomorrow you will hear the finalists. You will need to help us assess them and choose the overarching award winner. After that session, we are going to the part that I'm most excited about, but most nervous about, the unconference. For those of you who don't know what is an unconference is a session that you choose the agenda and you lead a discussion. But don't worry, we'll not leave you alone. We have Joshua Kaufman here with us in the room, an accomplished speaker, who will make sure that we will have a very stimulating and productive session. As we move to the meat of the event, I want to suggest and share with you 3 things that I recommend each of you to take away from this event and to focus in the next couple of days. Number 1, think about one big idea that you hear here in the next couple of days. We have some of the biggest names in telehealth with us in the room, some of the leader innovation solution with us. Take one thing that can help you to take back to your program and help to define a strategy and better results for your program in the future. Number 2, you will hear a lot of case study, best practice, return of investment during the next couple of years. You will see some very interesting solution. I suggest you pick a couple of them that can make an impact on your program now, and take them back and implement them and get your program to the next level. And number 3, we all made significant amount of time. We all made a significant investment of time by being here. Please make a point of connecting with at least 3 other customers, the Vidyo staff, and some of the other innovation companies that are with us here, and make a commitment to stay in touch with one another. Let's keep the fire that we built here burning until we meet again. Thank you very much, and enjoy the conference.